How does long time screen hours affect your eyes in the long run?
So this is a question that a lot of people ask,
Yes.
and thankfully we have we have seen that as of now we have not seen any kind of effects that are permanent, that are not reversible. Most of the effects we have are reversible, and thankfully not so serious that people need to get extremely worried about.
Right.
The kind of things that you can have with long-term screen time. So firstly, what is long-term screen time? So if you're using a screen for more than 4 hours a day, usually you will have some amount of issues.
Okay.
And the main issues arise because we don't blink frequently.
So what do you think are the symptoms which the patient is just seeing and they should consult ophthalmologist?
One of the most important things is if you have blurred vision or double vision, that is a good reason to see doctors. So our eyes are used to seeing things nearby as well as at the distance. When you start focusing only at near things, which is what we usually do with digital screens.
Yeah, true.
Your eyes are completely used to doing near work. So you're not seeing anything far. So because of that, your muscles are constantly contracting, and that can cause muscle strain. And when you look at a distance, everything seems blurred.
Happy and healthy morning, friends. Welcome back to Aura Health Hub. As we promised, we are going to have season number 2 even more exciting and amazing. So we have an amazing guest with us today, and the topic is even more interesting. This topic is such which we all are going to relate with very easily. We all go through this every day in our life. So let's welcome Dr. Shalmali Bacchav, a well-known ophthalmologist from Mumbai, and let's welcome her and hear more about her from doctor.
Okay, good morning everyone. I'm Dr. Shalmali Bacchav. I'm a practicing ophthalmologist and a cataract and oculoplasty specialist, and I have been in practice for more than 12 years now. And so today we are going to talk about screen time related disorders.
So, Dr. Shalmali, when I was thinking of inviting you for this episode, in my mind I was thinking whenever I will have the first episode with any eye specialist or opthal, the first thing I'm going to speak about is about the screen time issues and computer vision syndrome, because nowadays it's not only about children, but at every age you see that we all go through this in our everyday life. So we have a work hours like that. We are sitting at a desk with the laptop or phone. So the use of screen has become such that we all are facing this issue in our day-to-day life. So today we want you to share some expertise or create some awareness on this, how what is this and what can be done about it. So the very first question for our audience today, what is computer vision syndrome? And ये आजकल इतना ज़्यादा हम लोग इसके बारे में सुन रहे हैं. What is the point that it is getting even more worse day by day?
So computer vision syndrome or digital eye strain is basically the effect of our changing screen habits. Basically a prolonged increase in screen time in people of all ages, right from children to teenagers to older people. Everyone is using a lot of screens, and using such digital screens creates a lot of issues. Most of them are thankfully not permanent issues. The temporary issues you can have is any kind of dryness, any blurring of vision, rarely some kind of watering of eyes, redness, double vision, headaches, and it can even cause some kind of postural issues like neck pain and back pain.
Yes.
So these all issues come under the big umbrella of digital eye strain, and there are many different components to it, especially if you take in mind children and adults. They have different issues, and definitely we have to do something about it.
Yeah, true. That is why we have you here, so that we can create little more awareness about this. So my second question, again, we have a lot of people who have this thing in their mind, and let's create some awareness on that. How does long time screen hours affect your eyes in the long run?
Okay, so this is a question that a lot of people ask,
Yes.
and thankfully we have I mean, we have seen that as of now, we have not seen any kind of effects that are permanent, that are not reversible. Most of the effects we have are reversible, and thankfully, not so serious that people need to get extremely worried about.
Right.
There are things that you need to be worried about, but we'll cover that later.
Right.
So, the kind of things that you can have with long term screen time. So, firstly, what is long term screen time? So, if you're using a screen for more than 4 hours a day, usually you will have some amount of issues.
Okay.
And the main issues arise because we don't blink frequently when we are using screen.
Correct.
So you're using a screen, you tend to refocus on the screen, you tend not to blink often, and the average blink rate in a normal person is around 15 to 20 times per minute. But when you're using a screen, that goes down to as low as 5 to 7 times per minute. And because of this, what happens is the tear film dries up, your eyes become dry.
Right.
Your eyes, you feel a lot of discomfort in your eyes.
Right.
Want to rub them. Watering might start secondary to those dryness of eyes. And because of that, focusing on what is there on screen is also difficult. And it causes a lot of discomfort. To people.
Discomfort also. Right.
Other than this, some people might have a bit of blurring of vision. Again, some amount attributable to this dryness. You might have double vision, blurring of vision, might also have headaches. And the other thing that we don't usually think about is posture.
Right.
When you tend to not sit straight
Correct.
and back support and keep your screen at a slightly lower level, then what happens is you start having neck pain, back pain, and posture related issues. So all of these add to the eye issues associated with excess screen time.
Correct. So when you're talking about, so many issues can be there related to long time screen. So what do you think are the symptoms which the patient is just seeing and, they should consult a ophthalmologist?
Okay, so obviously we discussed that thankfully most of the issues associated with a higher screen time or a digital eye strain caused by prolonged screen time, these are reversible and thankfully not very serious. But there are symptoms which are serious that you should see a doctor, and some of them I will tell you now. So one of the most important things is if you have blurred vision or double vision, that is a good reason to see doctors.
Right.
See, more likely it is likely to be something that is not very serious, but it could be something serious.
Right.
The less serious thing is called accommodative issues. So our eyes are used to seeing things nearby as well as at the distance. When you start focusing only at near things, which is what we usually do with digital screens.
Yeah, true.
Your eyes are completely used to doing near work. So you're not seeing anything far. So because of that, your muscles are constantly contracting and that can cause muscle strain. And when you look at a distance, everything seems blurred. So that is a very normal thing which can go away. We have a lot of strategies to deal with that, including the 20-20-20 rule, which I'll cover later. But blurred vision or double vision can be due to some serious things also. So always better to consult a doctor who will tell you what is
Correct.
the
It's better to get advice
serious
from
from
expert.
yeah, right. Second thing that you need to worry about is if you're getting frequent headaches, especially very painful headaches where you want to vomit or you have had vomiting associated with the headache. That kind of severe headache should definitely be seen by a doctor.
Okay.
And ophthalmologists, they will usually, if you see a physician, they do refer you to an ophthalmologist to
Right.
see what are the effects on the eyes if it is related to the eyes.
Right.
And if not, then it might be something more serious.
Correct.
Other than that, the neck pain, back pain, so
Yeah.
that might also be a symptom of something more
And
severe.
that has also become very common nowadays.
Yeah. And you see a lot of people with those typical postural problems associated
right.
with
Even
prolonged screen
earlier
time.
it was not, for youngsters, but nowadays youngsters are also facing that issue.
Yes. So those are the more important symptoms. Other than that, if your eyes are very red, bloodshot red, your eyes are very itchy, painful, uncomfortable, then it is always better to see a doctor.
Right. Great.
Yeah.
So, doctor, one common thing I hear from my patients is after long hours on screen, their eyes are very, tired, heavy, and dry. What do you think is the actual reason for that?
So there are a lot of things contributing to that. One of the main things is one of the things we do instinctively in our normal life is blink a lot. We tend to look at things and keep blinking. The average rate of blinking is around 15 to 20 times per minute.
Right.
But when you see a screen, that drops down very sharply to something like 5 to 7 times per minute.
Right.
What this means is that because you're blinking less frequently, the tear film, which is like a protective barrier for the eye,
Right.
is not covering the eye that frequently. It tends to dry out. That
Right.
dryness causes a lot of issues like discomfort, pain, irritation. It causes that. Other than that, you also have this issue where our lifestyle, not just screens, but in general, our lifestyle is focused on doing things that are close by or
Close
near
by,
work,
yes.
as we call it
Yeah,
in
yeah.
ophthalmology. So, because we are focused on near work, we don't look at distance at all. When you're working on a screen that is near you, you tend to constantly focus on the screen and not look at the distance at all.
Correct.
What this means is your eye muscles, when you have to look at something near, your eye muscles will tend to contract and focus on them well. Also, when you are using a screen, you're constantly focusing, refocusing,
Right.
and there is a lot of attention being paid to that. So you completely forget that you should be blinking, you should be looking at the distance.
Right.
And this itself causes eye strain, pain, sometimes a headache that might manifest as something, feeling something painful behind the eye or around the eye.
Yeah.
So these are the reasons that your eyes feel tired and heavy after using screens for a long time.
So as you have told us so many, reasons behind that, can you tell us some quick remedies also, like how do we, overcome this situation?
So there are a lot of simple remedies which can sort of ameliorate at least 50 to 60% of the issues we have, maybe even more. And one of the most important things is to remember to blink frequently. So if you remember to blink frequently, some people even suggest ki write blink and paste it on your monitor so that you look at that and remember to
Yeah,
blink.
right,
So
right.
if you do something like that, it will remind you to blink more frequently, and that will also ameliorate a lot of the problems. Other than that, you get anti-reflective coatings on your glasses. So if you put that coating on your glasses, any kind of rays which come from the light, they are blocked, especially the UV rays are blocked, and that contributing to dryness also reduces.
Right.
Other than that, there is a very famous rule, you might have heard of it, the 20-20-20 rule, which means after every 20 minutes, look at something 20 feet or roughly 6 meters away for at least 20 seconds.
Okay.
So this helps to avoid the strain caused by constantly focusing at near.
Wow.
So that
That's
is
something, which everyone can execute in their day-to-day life. These are simple to follow remedies. I really liked the, blink wala idea, and this one 20-20-20, this is something we all should remember and should actually execute this.
Yeah.
Thank you so much.
And one more thing I would like to add, ki the 20-20-20 rule is for every 20 minutes.
Yeah.
If you are using screens continuously for even longer than that, then every 2 hours, take at least a 15 minutes break.
Yeah,
So
I think that is also required.
Yeah.
Correct. Correct.
Yeah.
So that is something I think we all should execute in our day-to-day lives. Even we have patients, who are working in IT industry and they have 10 to 11 hours screen job. So this is something which will be very, very helpful for them also.
Yeah.